from iHeartRadio. This is Medical Monday, presented by St. Dominic's. This is Randy Bell, and I'm here again with Jackie Murray, a cancer navigator at St. Dominic's, who joins us again this week to continue our conversation about breast cancer. October is Breast Cancer Awareness Month. Jackie, last week we talked about the importance of women being screened for breast cancer and knowing more about some of the symptoms. Let's go over some of those symptoms that a woman might want to be watching out for.
There may not be any symptoms. Some of the things to look for and just keep in mind is just a lump or a thickening, changes in the armpit, any changes in the skin or nipple, and then, of course, any changes from side to side or the symmetry. And that can certainly include pain or flaking or skin changes.
Jackie, certainly it doesn't happen as often, but breast cancer is an issue for men sometimes.
That's right. And we just want to make sure that men are also aware of that tissue and that part of their body. And if they do notice any changes in the skin or the nipple, any swellings or enlargements, to by all means take that information in and let a provider look and examine, just to be on the safe side.
When a patient is diagnosed with cancer, what happens next?
We're promoting annual mammograms and screenings, and that's going to be our number one approach, doing those annual mammograms. When folks have that done, a radiologist, which is a doctor that's going to go ahead and review those findings, will make a judgment as to whether they're within normal limits and when that patient needs to come back for follow-up. At that point, if they find something that's a little out of the ordinary, they'll make a determination as to when that patient has to come back for follow-up. Sometimes that can be every 3 months, every 6 months, come back in a year. Those things are determined by the doctor that reads those films, the mammograms. Now, if they find something concerning that needs an immediate follow-up, that the next thing that would happen, if we have a screening mammogram, we'll come back and do a diagnostic mammogram. And again, you're going to have a team of people helping you coordinate these appointments and help you through this process. The diagnostic is just going to take more pictures and give them a little bit more information. If they're still finding some changes that they want to see, have more data on, they're going to go ahead and plan for a biopsy. So there's going to be a little bit of tissue extracted from that breast, looked at under the microscope, and then another doctor team, a pathologist, is going to review that. And once you have histology or a positive pathology that there is actual cancer or disease, from there, there's going to be a plan that's put together, again, by your medical team, that's going to include a surgeon, that can include a variety of folks being medical and radiation oncology, et cetera. And at that point, you're part of that team as much as those physicians, and we look at what the guidelines are for best practice. And everybody is going to have their own journey on that, very individualized. Once you have a biopsy and proven cancer, then we want to make sure that there's the right treatment and the right sequence. And that can run the gamut from surgery to radiation to hormone therapy. It's not a one-size-fits-all. There's going to be, really the biology behind it. We do molecular markers and testing for what's actually driving that cancer. And then the team will put together a plan that best suits your needs.
And you and the other cancer navigators at St. Dominic's, that's where you come in, you guide the patients through that treatment process.
We're always there, again, as a safety net to help make sure that appointments are being made and kept. If there's any barriers to care, we work with you on that, and that could include insurance, finances, transportation, understanding of the process, the next appointment. It's really very individualized care, and we also have our social worker and dietitian that work at the cancer center as well.
And there has been, Jackie, a significant advancement in cancer treatment in recent years?
100%, and thank you for bringing that point forward. I say to families all the time, if you've experienced some treatment or care with a cancer diagnosis with a loved one or friend, just know every year, every 6 months, we have advances in treatment and care. If you look back 5 or 10 years, 20, 30 years, it is night and day difference, and it is 100% for the better. We have more survivors than ever before, and so I want that to be a comfort to anyone out there that is struggling maybe with deciding what to do or how to approach a situation that they're finding difficult. We look forward to working with anybody that needs a question answered or a little bit of help or guidance.
That's Jackie Murray, and I'm Randy Bell. Medical Monday is presented by St. Dominic's.